Very emotional story. Joining us now, the man behind the bill, State Representative Lou Lang. Julie makes a strong argument. Is this why you're backing the bill for people like Julie, Representative Lang?
It's exactly the reason. So we just went through a whole program in Washington. For months and months they were debating health care. This proposal to legalize marijuana for medical purposes is about health care. It's about relief of pain and suffering from thousands of people in our state without costing the state a dime. And I think when you do this under a doctor's care, which this bill requires, it's the safest and best thing to do.
And they're people with serious illnesses. Now, this is what I don't get. You tell me in Springfield last week you are about 2 votes shy of getting this passed, yet the polls show that you have the public support, that nearly 70% of the state backs it. So why don't you have the legislative support?
It's all politics, Anna. So I have talked to every member of the House, and interestingly, over 90 members of the House support this measure privately. But publicly, right now, only 57 or 58 of them are willing to vote for it. That's why the advocates have been in Springfield, like Julie and others, Jim Champion, Dan Lynn, lots of people were down there talking to legislators, and many have looked at them in the eye and said, you know, it's a really good idea, I just can't vote for it, and we have to get them past this.
Representative Lang, we want to break down here some of the key points of this bill. It would be a 3-year pilot program, then you'd go ahead and take a look at it. Patients would register with the health department. A move to make sure they're not charged with a crime. Only certain conditions are covered in Illinois. Severe illnesses like cancer and MS. Patients could possess up to 6 cannabis plants, so they'd be limited. But not everyone is behind this bill. Let's bring someone else into this discussion tonight. Peter Bensinger, a consultant on drug issues. You've also worked for the DEA. Mr. Bensinger, what is wrong with this bill?
Plenty. The first thing that's wrong with it is that the state legislature is putting itself in the role of deciding what is good medicine. The Food and Drug Administration is the ultimate decider on what is safe and effective medicine.
And this is not approved by the FDA.
It is not approved by the FDA. And in a matter of fact, Anna, it's not approved by the American Cancer Society, the National Society on Multiple Sclerosis. And let me just finish, because Lou had a chance to talk, and I want to just mention that I don't think the Illinois General Assembly has qualified itself to make what is good medicine.
Okay, and we're going to hear from some law enforcement.
$13 billion debt.
But let me ask you this, Mr. Bensinger, before we move on, I want to ask you one thing here, because we just saw a very compelling story from a patient. It's difficult, I think, to watch that and then say, how do you tell this woman who say this is the only thing that can really help her? How do you tell her, no, you're really sick, but I'm sorry, that it's not okay for you?
2 ways. Number one, she's cooking this medicine. 95% of the people in other states in Illinois will smoke this weed. And secondly, there is a pill, Marinol. Okay. It may not work for her.
It doesn't work for everyone,
but I can tell you, I could bring a heroin addict on stage today and tell you that that would help them for pain, and Vicodin or Demerol and morphine
also
wouldn't.
Addictive.
We shouldn't use anecdotal evidence when you have science and clear, rational proof.
Mr. Bensinger, let's talk about some of the science here. We want to move on, and we have some other points. Some of them which you mentioned, which are very good points. Some of the finer points of the bill that do cause concern. Dispensaries can open for business. They can sell marijuana anywhere, except 500 feet from a school. They can open next to your business, your home. They're only required to have minimum oversight. I think that's one of the points you're making, and security for their operation. Representative Lang, how do you respond to that? Aren't these legitimate concerns?
No. At California, they have dispensaries everywhere on virtually every corner, like 7-Elevens or Starbucks. This is a very narrow bill. We purposely made it narrow. There will be only a very small number of dispensaries, which we call medical cannabis outlets. The purpose of these is to only allow people who have a license to be able to get what they need, and if they have a caregiver, they can't even go to those dispensaries under this bill. If they have a caregiver, they have to take care of their own plants.
But the plants are a problem too, Anna, because in this bill, Representative Lang would allow 3 mature and 3 immature plants per caregiver. That's 2,200 joints. That's 30 cigarettes a day. You're going to get a wide diversion of marijuana on the streets of Chicago.
Mr. Bensinger, we're going to talk about the police agencies, because you used to be part of that.
I was the head of the DEA for 6 years.
That's exactly it. And a lot of the people in your community are calling this an enforcement nightmare. People don't like it at all, although the Illinois State Police recently went neutral on it. But we spoke with former police superintendent Phil Klein about it. And here's what he told us. This is what he's predicting will happen. Quote, street gangs will sell marijuana out of dispensaries. They'll use the profits to buy guns, heroin, and cocaine. The FDA should regulate drugs, not the legislature. To your point earlier, Mr. Bensinger, Representative Lang, Phil Klein says, and I talked with him, he said, you stick to issues like the budget, don't get yourself involved in these kinds of health issues.
And law enforcement is always against taking anything that's legal one moment or anything that's illegal one moment and turning it into something legal. They don't want anything to become legal that's illegal.
That isn't true. That isn't true.
And
the
additionally,
FDA wanted it legal,
if law enforcement doesn't seem to be too worried that every day kids are stealing Vicodin and morphine and Oxycontin out of the medicine cabinets of their parents and going to pill parties.
Let's talk
now,
about
I say that facetiously. Of course, they're concerned, but we don't hear them talking about that today. What we hear them talking about is a product that will help people.
All right, we want to talk about abuse and addiction issues, and here's what, let's listen in here what one doctor told us about that very issue.
There's a big difference between legitimate use and abuse. It has provided help for millions of patients. I don't think there's really anything wrong with medical marijuana if it's used appropriately for the appropriate indication.
Mr. Bensinger, we just heard from a patient. That was anecdotal, but this is a doctor saying it has real health benefits.
And the American Medical Association doesn't support medical marijuana. Neither does the National Institute on Drug Abuse. And on the point of medicine, you can find an individual doctor that may think it works, like you can find an individual patient. But we should make medicine available based on the science. Tribune did an exhaustive survey, and they looked at science, they looked at patients, they talked to physicians. And the conclusion of the science editor was that there was scant evidence that
Mr. Bensinger, I think the problem
was
is
safe
both sides use this kind of science.
Well, I want to just finish.
The real issue here, is, if I may say, is not even the science, it's the people. You have a doctor on, you have Julie on, you have other people who say this product works for them. Now, if a doctor can tell me that I should go take Oxycontin and have to lay in bed for hours drugged up and perhaps take an overdose, if a doctor can also say to me, this product will help you, take it. No one in the history of the world has ever died from an overdose of marijuana.
Bensinger, we're going to have to cut it off here.
Anna, one last thing.
Right,
I want to talk about the workplace, because this bill would destroy workplace drug safety, because it allows people to work with marijuana in their system, not using the drug testing programs that are in place throughout this country and throughout Illinois.
Gentlemen, we're going to have to stop the debate right there, because you both passionately believe in your points, and it's great to hear the real solid facts on this issue. I think there's a lot of misinformation on this issue, so we want to thank you both for participating in this debate, and hopefully you'll have another opportunity to do so. We want to shift the debate to talk about another important reality about this bill, the possible payoff. Quite literally, Illinois is $13 billion in the hole. Could the state cash in on legalizing marijuana? They're doing it in California, where last year medical marijuana dispensaries generated $1.3 billion in sales. The state sales tax on that, $105 million. Meantime, in Massachusetts, medical marijuana is not legal, but a study by a Harvard economics professor reveals that if it were, it would save law enforcement nearly $30 million a year. So it does save money, according to them. Mr. Bensinger, do you think that it would help free up some of the...
Absolutely not. Anna, cigarettes are taxed. The social cost of cigarettes, according to the Center for Disease Control, are $7 a pack. We get $1 federal tax. We get 81 cents for the state. But the social costs of smoking are tremendous. And marijuana has 60% more cancer-causing agents than a cigarette, and 4 times the tar. This isn't going to be. This is going to cost money. Accidents on the highways, police costs picking people up, and health costs that will be astronomical.
Thank you, Mr. Bensinger. We want to thank you for giving us. We wanted to give you the final thought, because we did give Representative Lang the first chance to speak. So thank you both again.
Thank you, Anna.
It is your turn to sound off. We hit the streets, and here's what you're telling us.
If it helps you feel better and eases your pain in some way and it's not hurting anyone else, I don't see why it's like any other medicine.
I'm undecided about that. It would save a lot of money, a lot of problems.